Hey, do you ever think to yourself, how do I take care of my skin with all this acne? Well, first of all, I'd say make sure you seek professional help for any acne blemishes that you do have, just to make sure there are no other underlying causes for your acne. For instance, if there are medications that you're currently on that you need to be off of that may be a culprit for your acne. Barring that, though, let's talk about what things influences or can cause an acne flare. Good old genetics, that's number one. So meaning if there's other family members, it could be direct or down the line, that have a tendency to have a lot of acne problems, you can inherit that tendency, okay? And it could be where you're secreting a lot more oils, so you have a lot more breakout, whether it be minor or some major breakouts, that can influence it as well. So when you know that, have that on board, it's good to get on top of the acne or get treated for it right away so that you reduce the chance of you having any significant scarring. So that's one. Two, you could also be influenced by hormones. And that's a big one, right? With all the hormone changes, puberty, all that jazz. And for my older ladies with the hormone changes, that can influence it. Because a mistake is to think that just because I'm not younger anymore, I'm no longer a teenager, that I can't get acne. Of course, wrong. You know, my ladies and adults, I should say, my adult ladies or men, I should say, get acne as adults. We can get it because of the hormone changes. So it is a thing. So I recommend that, of course, we may have to target treatment on the hormonal side of things in those circumstances, situation, but then that's something you want to speak to your healthcare provider about. Foods. Initially, we were thinking, does food have a part to play with? We weren't sure. But in all honesty, we do really believe that certain foods can increase inflammation throughout your body, which can indeed increase the risk for acne and other kind of what we call inflammatory disorders, such as your eczema, your psoriasis, and other disorders, HS or hidradenitis suppurativa. There are many other inflammatory disorders. So I educate my patients about reducing certain foods. Dairy products is one of the ones on my list. The milks, the cheeses, the sour cream, all of that can increase inflammation. So I say, hey, maybe do a food diary if you're not sure if you're consuming a lot or not. So you can get an idea of how much you're consuming on a regular basis. And if you find that's too much, go ahead and reduce, whether you cut it down by half, or if you're able to go ahead and just find a healthy substitute, as long as you don't have any other food allergies, then that's perfect. You can go ahead and do that and see how that works for you. Other things, I do have some people that, not that they have an allergy, but some of them may have a gluten sensitivity, and they find that certain foods, their breads, their pasta, may influence their breakouts. Something to try too. But I don't want you to go all hardcore. Just be mindful, again, keeping that food diary and doing elimination a little bit at a time, just to see, and doing one subset at a time to see if you notice a difference with the breakouts. That would be helpful. Fatty foods, so high fat content with your meats, I tell people do leaner meats. That would be helpful as well, because the fat content can also increase inflammation throughout your body. So just be mindful of that. Sugar, sweets, processed foods, our body's not meant to do all of that processing. Drinking lots of water, all of that also can be very helpful for helping to control your acne symptoms. Another thing that I talk about too is microbiome. So what is that? Microbiome is the healthy system that has been created. Microbiome in terms of the bacteria that's supposed to normally live in your gut. We have a gut microbiome, and then we have a skin microbiome. And now we're seeing a link between the gut and the skin. We want to make sure that's the healthy bacteria that lives there, that's helpful where digestion is concerned, with the nutrients that we use, and just help us to be healthy. Pretty much 70% of our immunity starts in our gut. So we want to make sure that our gut is healthy. But of course, over time, based on the foods we've eaten, based on the medications we've taken over time, especially on antibiotics, it has depleted or changed that microbiome. And so now it can cause other problems to develop over time. For instance, a lot of patients who are on oral antibiotic, they talk about, hey, I tend to get a yeast infection with oral antibiotic use. The reason for that is that although the oral antibiotic is depleting or reducing the extra bacterial infection that you have on the skin or wherever it's treating, you're also killing off the good bacteria that's supposed to help keep that yeast in check. And now the yeast is overgrown, and now, ta-da, you have a yeast infection. So that's what I'm talking about with the microbiome being upset. So I highly recommend, and also when I'm prescribing medications, if I'm prescribing an oral antibiotic, I recommend you have to get on a probiotic while you're taking the antibiotic, and a little bit even after. But for patients who come in for acne, for instance, I recommend at least a 3-month sort of reset is what I call it. I just kind of came up with that number for 3 months. Nothing literally in literature, but 3 months is a good time frame. Now, for people who we don't tend to eat healthy on a daily basis, you can use it as a supplement. It's not a problem. But for sure, if you're on an antibiotic, I highly recommend you being on a probiotic as well. That way you're replenishing all the healthy stuff back into your system as you're taking the antibiotic. So we want to make sure you're doing that. There are some suggestions. I'll make sure post it so that you can have it. Feel free to check it out. Feel free to do your own research. Some of these probiotics have a prebiotic combination. The difference is the probiotic is the actual healthy bacteria that's being replaced in your system. The prebiotic is the foods to help this probiotic, these healthy, good bacteria to thrive or to grow in our system. So some have that combination, and I take one myself that I order online. So I'll put some suggestions down below so that you have access to that. But those are some of the things that I highly recommend. Now, otherwise, in terms of the space of acne, make sure that everything you're using is gentle to the skin, not stripping the skin, because then now you're changing up the normal microbiome off your skin. And sometimes in our attempt to really try to get rid of this acne, we get too aggressive, and that can cause the problems on top of it. Also, be mindful of other products you use. Be mindful of products that you use on the hair that can come on the face. Be mindful of products that you're using on your skin. And what I mean by that is, for instance, if you've changed up products that maybe have a lot of perfumes to it, or even some people that do body sprays, they get some of these bumps and breakouts that are itchy, and they may look like acne, but those are actual irritants. So again, follow up with your provider just to make sure that you're getting evaluated appropriately, to make sure indeed what you're seeing on the face or on your skin that is indeed acne and not something else. So that's why I want to make sure you check in. But all this other information is just to help to supplement what you're already doing for your acne. So do me a favor, subscribe to my channel and give me a like so that I can give you additional wonderful information if you find this useful. Thank you.